Hello, everyone. I hope you can hear me. Welcome again to our Facebook Live this Thursday, 7 to it's actually 5:30 to 6:30 p.m. tonight. So, how are you doing, everybody? It's Happy Thanksgiving Day, and I hope that you are all celebrating your special day tonight. Okay. Anyway, let's welcome everybody here. So, everybody. Um, Yes, so we have some comments in the comment section. I asked a question earlier. What is something that you are thankful for during this celebration? I know that we are in the midst of a pandemic, and I know that it is highly challenging for all of us to be in this kind of situation. However, we are still inspired to really be grateful for the things that we have and just really think of all the other challenges that we have around the world right now. So thank you very much, everyone, for being here. I know that you're all very busy with tonight's festivities, but hopefully you're all staying safe as well. Okay, so let's welcome some people in the comment section. Okay, so hi Amber, how are you? So I am fine, sir. How are you? Okay, so nice to meet you here, Amber. And I know that Amber is from the Philippines. Okay, now we also have Sylvia. So Ma Sylvia actually thankful for preservation of life, good health, strength, and enormous countless blessings. So that's what she's saying. And also we have Maria Mendeville. So she's saying that thank you for all the blessings from God, keeping me and my family safe, free of COVID. God bless us all and pass our NCLEX soon. Thank you very much for that special message. And then we have Totoy Bato, and he's saying that he's Ivan and he's from the Kingdom of Saudi Arabia. Okay, all right. So, everyone, thank you for being here. Tonight, again, we have prepared some questions for you, which is prioritization and delegation. And then also, we have some special promos for tonight. Aside from the free 90-day online NCLEX Academy access winner announcement, we're going to also tell you what we have in our online NCLEX Academy at this time. So we have some promos that probably will help you and in your NCLEX preparation, especially the pricing. Okay, so we have bundled some interesting pricing for all of you guys. Okay, all right, so it's almost at the end of the year, so we are all celebrating, and hopefully we're all coping very well with the whole COVID situation that's going on right now. Okay, so without further ado, everyone, okay, I would like to introduce myself. My name is Mr. Alan Matus. I'm a nurse educator for almost 25 years, and I have been teaching nursing students past the NCLEX, and also currently I am a nursing faculty in a nursing program. And also I'm the founder and the president of Matus Nursing Review and Matus Nursing Review Online NCLEX Academy. Also, I'm an author. I published a book in Amazon. You can find it there. So it's actually now available in the Philippines as well. You can actually purchase this book, and also in the Philippines, as what I have said, just email Matus Nursing Review Academy at gmail.com. Okay, all right, so thank you very much, everyone. That's going to be the book. If you're interested, let us know. Okay, all right, so before anything else, also, I would like to greet everyone a happy Thanksgiving. Okay, happy Thanksgiving. As what I have said, we can overcome all of these challenges and just continue to get inspired and continue and get motivated with passing your NCLEX examination. Okay, so that's the most important message that we have for you for tonight. That do not give up and just give your 100% so that you will finally achieve your dream, which is passing your NCLEX exam. Okay, so so we have Sir Matus, one of my colleagues, won your 90-day promo. She referred your live. Very good. So hopefully you will win tonight then. Okay. All right. So our announcement for tonight is going to be some promos that's going on in our online NCLEX Academy. So happy Thanksgiving, everyone. So we have the Super Thanksgiving Day and Black Friday sale. The limited time offer starts November 26 to 30, 2020. Okay, so we have a 50% off of our for the self-study comprehensive online NCLEX review course, which is the 1-year unlimited online access NCLEX review. So instead of $499, it's only $249.50. We also have a 30% off of our highly acclaimed NCLEX Success Workbook. Okay, instead of $94.50, that's only $66. And then 30% off to our 12-week fast track live NCLEX review webinar. So instead of $399, it's only going to be only $280 only. So remember this promos, everyone. I hope that you will sign up and support our program, everyone. Okay, and this is only again until November 30, 2020. All right. Okay, so that's our Super Thanksgiving Day and Black Friday sale, everyone. So we are actually really slashing the prices off for you guys. Okay, especially during these challenging times. Okay, so all right, so another one, we're gonna have our testimonial, everyone. Okay, so this testimonial is from one of our students who commented in our online NCLEX Academy. So her name is Charlene, and she said, I want to thank you, Professor Matus. Your lectures are above and beyond the best review from all the reviews I have been taking for the past. I wish I knew your review program since day one. I feel so much positive learning. I will recommend your NCLEX review 100%. The best lecture in the universe. So far, I'm learning so much from you. So that's really very heartwarming to really read something like this in our online NCLEX Academy. A student who is having an aha moment during this while studying for online NCLEX Academy. So thank you very much, Charlene. Okay, so aside from the testimonial, okay, I know that everybody's excited about this. So again, we are going to have your free 90-day online NCLEX online access NCLEX review. Okay, so any student who joins tonight will be part of our drawing for the winner that will be announced next week. Okay, all right. Okay, so get ready for this chance to win. All right. Okay. All right. Okay, and I would like to request everyone also if you can share, okay, or if you're watching in Facebook, okay, or in YouTube, can you please click subscribe, okay, and let others also benefit from this program, everyone. All right. Okay, so what are you waiting for, guys? Click the share button. Okay. All right. Okay, so is everybody ready, everyone, for our first question for tonight? So we're going to have the first question, which is going to be all about prioritization, everyone. And then we also have delegation later on. Okay, but most of the questions that we have tonight will be on prioritization. Okay, so let's have the first one, everybody. Okay, so we have a special message here from Totoy Bato. He said, working as a nurse here in Kingdom of Saudi Arabia. Okay, very good. Nice to meet you here tonight. Okay, all right, so everybody, are you ready for our first question? Okay, all right, so we're gonna have our first question for tonight. Okay, this is your prioritization question, everyone. So the nurse cares for a client who has advanced emphysema. Which of the following statements of the client requires the most immediate attention? A, I have to sit up and lean forward so I can breathe easier. B, I have been having difficulty sleeping at night sometimes. C, I have noticed that my secretions have become more copious and thicker. And letter D, I usually need help walking into the bathroom. Again, I will read the question. The nurse cares for a client who has advanced emphysema. Which of the following nurse statements of the client requires immediate attention? A, I have to sit up and lean forward so I can breathe. B, I have been having difficulty sleeping at night sometimes. C. I have noticed that my secretions have become more copious and thicker. Or D. I usually need help walking into the bathroom. So what do you think is the answer, everyone, for this? Okay? A, B, C, or D. Okay? So you have to remember the technique in answering this question is to find out what are the signs and symptoms of emphysema and which one do you think you need to report. All right? Okay? Which one do you think you need to report? Okay? Let me see. So some of you are giving your answers now. Let me see if you're getting the right answer, everyone. Okay? And please put the rationale for your answers. Okay? So, what are the signs and symptoms of emphysema, everyone? The signs and symptoms of emphysema will be wheezing, orthopnea, or difficulty breathing when lying down. Sometimes there's tightness in the chest or chest pain a little bit. And then also exertional dyspnea, which is the presenting symptom, meaning that whenever they do something, they get tired immediately. Fatigue is also a common manifestation of emphysema. Okay, fatigue, clubbing of the fingers. Those are the classic signs and symptoms of COPD. And we all know that emphysema is the most common type of COPD, which is characterized by destruction of the alveoli that results into the hyperinflation of the air sacs due to air trapping. Okay, so in this situation, everyone, let's find out what is the answer. Okay, so the answer to this question is going to be letter what? Okay, everyone, that's going to be letter C, the answer. Okay, now why is letter C the answer? The fact that the patient said, I have noticed that my secretions have become more copious and thicker, then we need to explore further. Why is it going on? And probably the condition is getting worse. And especially if the secretions turn yellowish or it's purulent, then there's infection going on. But the fact that the secretions are thicker and more copious, maybe one reason is the hydration level of the patient, maybe. So the patient probably needs to drink more water, okay? And this is an airway issue, your letter C. Now, letter A is not the most alarming choice because letter A is I have to sit up and lean forward. That's a characteristic preferred position of clients with emphysema. They prefer to sit up and then to lean forward because that allows them to breathe easier. So leaning forward elevates the clavicle and provides enough space for pulmonary expansion, and that's why letter A is the preferred position. So A is not the answer. Now your letter B, I have been having difficulty sleeping at night sometimes. Well, insomnia is part of the manifestation of your emphysema. Okay. B, or insomnia, can be a concern. Okay, because we need to make sure our patient is able to sleep. However, if you compare B and C, C is more alarming or more concerning compared to your letter B. Okay, your letter D, I usually need help walking to the bathroom. Patients with emphysema, the main manifestation will be exertional dyspnea. So for them, just walking into the bathroom could be a big effort for them, and that's why usually they may have fatigue or maybe they will need assistance in going into the bathroom. So the answer is going to be letter C. Okay, so very good, Amber Liu. The answer is going to be letter C for this question, everyone. All right, so let's see who got the answer to this question. Okay, so letter C, very good. Okay, and remember, it may be something that is sudden or new. Okay, a new change from the patient. Okay, all right, so let's proceed to the next one. Okay, get ready, everyone. So we have another question. This is another respiratory question. So it seems like tonight, most of the questions that we have are respiratory. And I think it is a little bit relevant because we are in the moving towards the winter season. So we all have now respiratory problems going on. Not only COVID, but we also have your flu, okay? and other respiratory viruses. Okay? All right, so let's have your number 2 prioritization question. The registered nurse is teamed with a licensed practical nurse to care for clients with respiratory disorders. Which of the following actions of the LPN requires intervention by the RN? Again, the registered nurse is teamed with a licensed practical nurse or LPN to care for clients with respiratory disorders. Which of the following actions of the LPN requires intervention by the RN? A. Asking the client to inhale slowly and deeply while using the incentives parameter. B. Removing the N95 mask outside the room after caring for a client with tuberculosis. C. Providing sips of water to a client who just came in after a bronchoscopy. Or D. Administering the albuterol before the steroid inhaler. Okay? So the registered nurse is teamed with a licensed practical nurse or LPN to care for clients with respiratory disorders. Which of the following actions of the LPN requires intervention by the RN? So this is a negative question. Okay? So A, asking the client to inhale slowly and deeply while using the incentives parameter. B, removing the N95 mask outside the room after caring for a client with tuberculosis. C, providing sips of water to a client who just came in after a bronchoscopy. Or letter D, administering the albuterol before the steroid inhaler. Okay, so what do you think is the answer, everyone? Okay, all right. So most of you are giving your answers now. Okay, it seems like you're getting the right answer. Let me see. Okay, are you sure that your answers are correct, everyone? Because I need you to put the rational. There could be a better answer as well, so double check all the other choices. Okay, all right. This is a classic NCLEX question. Okay, and it seems like all of you know the answer to this question. Let me see. Okay, all right. The correct answer to this question is going to be, that's correct. It's going to be letter C, everyone. Very good. So C is the answer because of the risk of aspiration, and usually that applies after a bronchoscopy or any scope that is being inserted through the mouth. Okay, because when we do bronchoscopy, we apply or administer a neck anesthesia that eliminates the gag reflex. So we cannot give any fluids by mouth when the patient comes back until we check the presence of the gag reflex. Okay, so this applies to any procedure that includes insertion of a scope through the mouth, like your bronchoscopy, gastroduodenoscopy, for example, your endoscopic retrograde cholangiopancreatography, for example. So any of those procedures. So you cannot give anything by mouth, okay, unless you check the gag reflex. Now, letter B, removing the N95 mask outside the room. Well, that's correct. The N95 must be removed outside the room, okay, not inside the room, especially with tuberculosis, and that is an airborne infection. Letter A, that is the correct procedure for using the incentives parameter. So that the piston will rise, the patient should be asked to inhale slowly and deeply in order to facilitate expansion of the lungs. So letter A and B are correct. Now letter D, administering albuterol, your bronchodilator before the steroid, that is correct. Okay, we have to give the bronchodilator first before your steroid inhalers. Okay, so just a few reminders about this question, everyone. This is a characteristic negative question. Okay, when you say negative question, it means that 3 are correct, 1 is wrong, and that wrong option is the answer. So in this situation, A, B, and D are correct actions of the LPN. Letter C is a wrong action, and that's why there needs to be an intervention. Okay, and I do have another question. How do you check for the return of the gag reflex? You have to use a tongue depressor. Okay, tongue depressor, let the patient open his or her mouth, and then you place a tongue depressor, touching slightly the back of the throat, and then you will see the gag reflex. Okay, and then also, what is a very important nursing intervention after administration of a steroid inhaler? That would be making sure that the patient rinses his mouth with water, or oral care is really very important after giving a steroid inhaler to prevent fungal infections, which is a common side effect of steroid meter dose inhalers. Okay, so this is a negative question, everyone. Some students have a hard time answering this question, so be careful when you have a negative question. Okay, very good. And someone said that we have bronchodilators first to dilate the airway, to open the airway, so that the steroids can penetrate the lower airway. Very good. Okay, that's correct, everyone. So we have another prioritization question. So count your points, everybody. Okay, and can you please put in the comment section also from which country are you coming from, everyone? Okay, and if you know some friends or people who attended the program and then passed the NCLEX, please let us know so we can do a shout out for these people who passed the NCLEX. Okay, and if you have time, please do a Facebook recommendation. All right, so please do a Facebook review telling us how you like this program. Okay, all right. So the third question that we have is a delegation question, everyone. Okay, so Kadiatu, hi Kadiatu, very much welcome in the online NCLEX Academy. Okay, all right. So the registered nurse is the preceptor for a new graduate nurse. Which of the following clients may be assigned to the new nurse? Okay. A, the 29-year-old client recently admitted for flail chest due to a car accident. B, the 38-year-old client who needs health teaching due to a new diagnosis of diabetes mellitus. C, the 45-year-old client with multiple sclerosis who requires intermittent catheterization every 3 hours. D, the 60-year-old client who underwent coronary arteriogram during the previous shift. Again, I will repeat. The registered nurse is the preceptor for a new graduate nurse. Which of the following clients may be assigned to the new nurse? A, the 29-year-old client who recently admitted for flail chest due to a car accident. B, the 38-year-old client who needs health teaching due to a new diagnosis of diabetes mellitus. C, the 45-year-old client with multiple sclerosis who requires intermittent catheterization every 3 hours. Okay? Or D, the 60-year-old client who underwent coronary arteriogram during the previous shift. Okay. So the technique in answering this question, everyone, is going to be finding the most stable patient. So who is the most stable patient in this situation, everybody? Okay? Because for a new graduate nurse, you don't want to give a patient that requires complex nursing interventions. Okay? You want to focus on a patient, okay, that's more stable and can be handled by a new graduate nurse. So avoid complex interventions. Okay? So who is the most stable patient here? Okay? All right? So this is a very interesting question because I can see that most of you have different answers in this situation. Okay? So I want you to really look at the question carefully, everyone. I'm giving you another chance. For some of you, change your answer if you think that you found the most stable patient. Who is the most stable patient in this situation? Okay, so let's proceed to the answer to this question, everyone. This is a very interesting question. I can see that some people have different answers at this time. Okay, all right. So, what is the answer to the question, everyone? Let's have it. Okay, so the answer to this question, everybody, is going to be, all right, so that would be letter C, everyone. Okay, now, why is it letter C? A, 29-year-old recently admitted for flail chest. That is a patient who is unstable, very unstable because recently admitted, right? Okay, then letter B, you don't want to give that to a new graduate because health teaching for a new diagnosis of diabetes, that is complex. Okay, the person needs more information, complex information about diabetes management, like medications, for example, and the person will have a lot of questions. So, not letter B. Okay, and always remember, we do not delegate teaching. Remember that? No evaluation, no assessment, no teaching. Okay? Letter D, 60-year-old who underwent coronary arteriogram during the previous shift. When you say coronary arteriogram, that is an invasive procedure. We're going to use a contrast medium. The patient needs to be monitored because it's just during the previous shift. Okay? We need to assess the insertion site for bleeding. So letter D is an unstable patient, okay? Because the patient just underwent a procedure during the previous shift, okay? However, your letter C, okay, is a patient with multiple sclerosis, and intermittent catheterization is within the scope of practice of a new graduate nurse, and that's something the new graduate nurse can do, right? And remember that multiple sclerosis is usually a chronic condition, so meaning that is more of a stable patient, right? So the answer is going to be letter what? Letter C, okay? Letter C is the answer, okay? Now, another way to approach this question is this: also look for clues. You know, if the condition happens suddenly or if it's recent, that could be an indication of an unstable patient. Okay, but you really have to look at the whole situation. So, uh, letter um, letter B, health teaching to a new diagnosis of diabetes. And also, one thing that can happen in this question too, if a patient is about to be discharged, that is not something that you can delegate as well, because discharge instructions, management, planning, that should be for the registered nurse. Okay? Any patient who is requiring health teachings before discharge. Okay? But in general, remember, patients who are going to be discharged are also stable in a way. Okay, the fact that they're being discharged. But when you talk about health teachings before discharge, you want to give that to the RN. Okay, because again, the golden rule is we do not delegate evaluation, assessment, and what? And teaching. Remember that. Okay, so always look at the scope of practice and the clinical condition of your patient. Letter C is the answer, everyone. Okay, so all right. Okay, so yes, I got no teaching for a new grad. Okay, anything new, don't give it to the new graduate nurse. So I hope that you learned something tonight, everyone. Okay, okay, so the answer, okay, is going to be letter C, everyone. Okay, so letter C. Very good. Okay, so for those who answered letter C, congratulations, you got the right answer. Very good. Okay, so let's have our last question for tonight, everybody. Are you ready? This is going to be delegation. Okay, so our question for tonight: the registered nurse works with the unlicensed assistive personnel, okay, and licensed practical nurse in caring for a client who came in for exacerbation of cystic fibrosis. Which of the following tasks can be delegated to the LPN? Select all that apply. A. Administer oxygen at 3 liters per minute. B. Provide frequent mouth care. C. Perform tracheostomy care every shift. D. Give pancreatic enzyme replacements. E. Assess the odor and consistency of stools. And F. Develop a care plan to share with the respiratory personnel. Okay? Again, the registered nurse works with the unlicensed assistive personnel and licensed practical nurse in caring for a client who came in for exacerbation of cystic fibrosis. Which of the following tasks can be delegated to the LPN? Select all that apply. A. Administer oxygen at 3 liters per minute. B. Provide frequent mouth care. C. Perform tracheostomy care every shift. D. Give pancreatic enzyme replacements. E. Assess the odor and consistency of stools. Or F. Develop a care plan to share with the respiratory personnel. Okay? What's the answer in this question, everyone? Okay. What will be assigned to the LPN, or what can you delegate to the LPN? Be very careful with your answer, everyone. You have to look at the scope of practice. Make sure that when you're looking at the option, is it for the LPN or UAP or registered nurse? Okay, let's see if you're getting the right answer for this question. I would like to give you second chances. Some of you the answers are wrong, so please double check your answer, everyone. Okay, double check your answers. Some people have wrong answers, so you can always change your answer. Okay, so 10 more seconds, everyone. Let's see. So we have attendees from the Kingdom of Saudi Arabia as well. So thank you very much for attending here tonight. We do have some videos in YouTube that you can watch. But if you want the complete set of our Facebook Live, you can watch them in the online NCLEX Academy. And of course, if you enroll, then you can have all access to the Facebook Live that we have, all the recorded videos. And a lot of our students are saying or have really said that the Facebook Live has helped them a lot in their delegation and prioritization. Okay, so what is the answer to this question, everyone? Very interesting because we have different answers from different people. This is a highly important question in the NCLEX, everyone. Okay, the scope of practice of LPN and then also your UAP and RN. So the answer, everyone, is going to be, okay, so the answer is going to be, let's see, that will be A, C, D, and E. Okay, everyone. So letter A, giving oxygen, is within the scope of practice of the LPN. Okay. Letter C, tracheostomy care, that would be within the scope of practice of the LPN. D, pancreatic enzyme replacements are usually oral medications, and that's within the scope of practice of the LPN. E, assessing the odor and consistency of stools, correct. We said the last time in our Facebook Live that LPNs can do specific assessments, not in-depth or comprehensive or initial admission assessments. Okay, LPNs can do specific assessments like assessing the color of the stool, listening to the bowel sounds, checking the heart rate, for example. Okay, now letter B is the scope of practice of the UAP. Okay, letter B is for the UAP, frequent mouth care. That's part of your activities of daily living. Okay, so that's UAP. Now letter F, develop care plan to share with respiratory personnel. Remember that care planning is part of the responsibility or task of the registered nurse. Okay, planning, evaluation, assessment, teaching, and planning. Okay, so that would be for the registered nurse, everyone. Okay, all right, so Amber, okay, said yes, she got it. Well, we have one question from one of you guys. One said that, hey, letter E, assess the odor and consistency of the stool. That's for the RN. However, remember that what we said in our previous Facebook Live, LPNs can do specific assessments only, or focus assessment, not comprehensive assessment. The assessment that we're talking about that should not be delegated with the RN is your comprehensive or in-depth assessment. So for example, you have a patient who just got admitted. The one who has to do the head-to-toe or comprehensive assessment for that will be the RN. Okay, a patient who needs comprehensive pain assessment, that has to be the registered nurse. Okay, but assessing, listening for bowel sounds, that would be okay for the LPN to do. Now, whatever is the result of her assessment, the odor and consistency of stool, then she has to report that to the registered nurse, especially if there's any abnormality. Okay, so, but the registered nurse is the one responsible for analyzing the information, really finding out what's going on with your patient. Okay, so the answer is going to be A, C, D, and E. Hopefully, You got that right, everyone. Okay. So Taurus Mess said she's right. Very good. Okay. Congratulations for getting the right answer. All right. So everyone, I would like to thank you, okay, for being here tonight and for attending our short session for the Thanksgiving or delegation prioritization. But we are now going to announce the winner of our 90-day free access online NCLEX Academy. Okay. And the winner for tonight is going to be okay, so we have Anelia Oriola Yap. So she is our winner for the free 90-day online access NCLEX review. So please let us congratulate Anelia for winning this tonight. Okay, congratulate her. Okay, and Anelia, if you can please send us an email so that we can enroll you into the program. Please email us immediately and congratulations. Okay, all right. So again, everybody, thank you very much for being here tonight. I hope that you will be safe for the Thanksgiving holiday, and also the Black Friday sale is going to be tomorrow. And of course, I'm here. You know, my mission is to always make sure that I deliver a program that is simple, fast, and easy. And don't forget, we have some discount sale going on until November 30. We have 50%. Okay, prices off in some of our programs. So thank you very much, everybody, and you all have a good night, everyone, and happy Thanksgiving.